Good afternoon, everybody, and welcome to our Mastermind webinar today on team-based care. Together, everyone achieves more. Our presenter today is Sarah Houlihan, and she's a Primary Care Improvement Officer. Before we go any further, I'd like to acknowledge the traditional custodians of the lands that we walk, reside and work upon. We pay respects to our First Nations people and valued the continued connection to culture, country, waterways and contributions made to the life of our vast region. This webinar is being recorded and will be available in our education library on our website, along with a copy of Sarah's slides. If you have any questions, please type them into the question box and we will endeavour to answer them at the end of the presentation. And please fill in the evaluation. It will only take 30 seconds before you leave. All right, thanks everybody, and I'll hand over to you, Sarah.
Thanks, Jenny. So thank you everyone for taking the time to join us today. I'm coming to you from Darkinjung land on the Central Coast, and I also extend my respect to Elders and any First Nations people joining us today. As Jenny said, my name is Sarah. I'm a Primary Care Improvement Officer and a primary care nurse. I have a passion for preventative and proactive care. So our primary care improvement team often receive questions around team care. So it felt timely that we explore some of the different Medicare subsidised team care available for our patients. The benefits of team care come from recognising that each member of the team provides a specialised knowledge and experience in an effort to provide the highest level of care for our patients. We can better identify and reduce gaps in care and meet the holistic needs of the patient rather than just focusing on the most important or obvious need or just focusing on disease-specific issues. So a person-centred plan will take into account the goals and needs of the individual. And team care incorporates not only the medical, but also, their social, cultural, emotional, spiritual, and physical influences and supports that are involved in their life. When we collaborate with other providers directly, obviously we save that patient from needing to tell their story over and over, and we can gain insights from others in their area of specialty. So of course, benefits can come with barriers, and we're all probably very familiar with these, in general practice, making sure that we are doing that collaboration to meet the requirements of the Medicare benefit scheme, ensuring that our documentation is correct for billing purposes and to avoid audit, and having efficient systems in our practices for preparing the plans, managing billing, organising timely reviews. For patients, it's so important, of course, that we ensure that they have access to the appropriate service. With our PHN covering such a broad area, obviously there can be that risk that the right service for that patient isn't available locally. And thankfully now we've got more options around telehealth, but it's having those conversations with patients around what we're hoping to achieve by working with other members of the team so that they can also understand the importance. Affordability, of course, is a big concern for many of our patients. And that's where having these team care arrangements or referrals to other providers under Medicare can certainly assist. But when we're thinking about barriers for patients, obviously the biggest thing we want to consider is their health literacy. Do they understand why they're being referred? Are their expectations realistic? Do they see it as important that they will actually go to the appointments? And how will the goals and treatments outlined in the plan benefit their individual goals. And then for our allied health and other providers, I hear from them that it's so important that the patients come to them with those realistic expectations. Patients should have been informed that there may be a cost involved in the allied health service. Then our allied health providers need adequate information to be able to collaborate and provide the best services for the patients. And of course, we recognise that any kind of referred service for our allied health does involve additional paperwork. So there's some simple things that we can do to make team care easier for everyone, starting from those very first communications. So by establishing good systems within our practices to manage collaboration and claiming of Medicare services like team care arrangements, utilising the reminder functions in our clinical software and using them well, automating reminders where it's practical to get those efficient systems in place. We can focus on patient-centred care by ensuring that the information that we give to the patient meets their level of health literacy. We include the patient as a partner in their own health and discuss goals and actions that they can take for self-management. Going back to that, discussing realistic expectations, listening to the patient's concerns regarding their access or costs to ensure that they will attend their referred services and that we don't waste the opportunity by coordinating care for services that they just won't attend. And we also want to, as part of having those clear expectations, use the correct wording. So we're not bringing patients in to give them their 5 free visits. We are coordinating the patient's care to make sure that we're not missing anything and that they're getting the best care for their individual needs. Absolutely, we may be able to refer our patients with chronic and complex conditions, and those visits are subsidised by Medicare. But we need to remember, of course, that just as many general practices have moved to mixed or private billing, so have many allied health providers. And it is an accreditation standard that we inform our patients that referred services may incur costs. And the most important thing when we are referring, if we're doing a written collaboration, is writing good referrals. So just as we wouldn't ask a medical specialist to provide non-specific care, please don't expect allied health providers to guess what the patient needs. We need to be specific, provide current and relevant information about the patient's overall health and care needs, and share any investigations that are relevant, provided that the patient has consented to this. So we'll start with the team care arrangements. The actual team in a team care arrangement can be made up of all of the people that are involved in the care of the patient. But to meet Medicare requirements, we must collaborate with at least 2 of them. We're not limited to just those 2, but before we can process the billing, we do need to be collaborating with those other providers, and one of those can be a medical practitioner. It's important that we take note that each person must be provided
Sarah, can you hear me? You have just frozen. Okay. Hi everyone. We seem to be having a little bit of a technicality issue. I think Sarah has gone, but she will be back in a moment. So if you can just give us a sec and we'll try and get it back up and running. Hi everyone,
goodness.
We're back.
Thank you everyone for your patience. Not what we wanted to happen, but that's okay. All right. Now, sorry, bear with me for 2 seconds. All right, so the team care arrangement team members. We must be providing different types of service. So this means that while our practice nurses can absolutely be members of the team, we cannot be one of the collaborating providers because we're providing our services under the supervising GP. Can't seem to get. I'm so sorry, everybody. Thank you for your patience.
Sarah, it might be because you left and then have come back in. So I'm just going to make you the organizer again.
There we go.
I can see your emails.
Oh, well, that's no good. Okay. Here we go. We'll swap that over and we're back in business.
Lovely.
Okay. Thank you everyone for your patience. So when we're identifying the patient's team, it's important that we don't restrict ourselves just to health professionals or services that can be referred to under team care arrangement referrals. And where relevant, these examples here can all be important members of the care team. And including them in our plans and communications where relevant really helps paint the picture of the patient's overall needs. So by including all providers in our plans helps improve patient outcomes by reducing the risk of gaps in care, saving the patient having to tell their story over and over, and improving communication between providers. There we go. So Services Australia provides MBS education resources about claiming requirements for medical practitioners, allied health professionals and practice staff, including the steps that we've got here. And sometimes it can really help, especially if you're new to doing care planning, to break down the steps into those 3 sections of coordinating, documenting and completion. And something we commonly notice is confused is the terms consent and collaboration. So A claim for item 723, team care arrangements, requires the GP to consult with at least 2 collaborating providers for different treatments. But this is more than simply gaining the consent of those providers to participate. The GP or a member of their team needs to be discussing with the patient and the collaborating providers on what particular services and treatments that they will be providing. And we cannot be putting billing through until that collaboration has happened. The main, if nothing else that you take away from today, it would be great just to remember that consent essentially is what the patient gives to us. They consent to us developing the plan, they consent to us sharing information with other providers, they consent to us bulk billing if that's what we do. Collaboration is communication. Having that two-way conversation with other members of the team to ensure that we are addressing the specific needs of that patient. So the allied health services for First Nations people are very similar to the individual allied health items available to patients under team care arrangements. However, these items provide an alternative referral pathway for our First Nations people to be able to access allied health services even if they don't have a chronic disease. Now, they do need to have a health assessment in place, but the referrals for our First Nations people are separate to chronic disease management. And certainly if the patient meets the eligibility criteria for GP management plan and team care arrangement, then they can also have that for a total of 10 allied health visits over the course of the year. So the diabetes group services are where we can organise for our patients with type 2 diabetes to be able to have an annual suitability assessment and up to 8 Medicare subsidised group visits with either diabetes educators, exercise physiology or dietitians. The group services can be provided by one of those providers or a mix of all three, whichever is going to be the most appropriate for the patient. Where group service attendants and the relevant allied health providers may be included in the team care arrangement as they're part of the patient's care team. The eligibility for diabetes group services is actually determined just by having the 721 GP management plan. So we're not taking away any of the 5 subsidised team care arrangement referrals. These can be done in addition to that. And then we've got our follow-up or our visits for our practice nurses and Aboriginal health practitioners to provide support and monitoring to our patients with chronic disease and to our First Nations people in between formal reviews and plans. And these items are designed for things like checks on clinical progress, monitoring how they're utilising their medications, providing education and self-management advice, and following up how patients are managing in terms of those access, the cost, of breaking down those barriers to encourage patients to receive the team care that we have discussed with them. So the 2023 International Nurses Day theme of Our Nurses, Our Future is so relevant to the topic of team care as it's designed to shine a light on moving nurses from invisible and invaluable to invaluable in the eyes of policymakers, the public, and those who make decisions affecting the delivery and financing of healthcare. I wish all my nurse colleagues a very happy International Nurses Day for this Friday. And I really do appreciate your patience in joining us today. You'll see throughout the slides, which will be available in the Education Library, I have included lots of links to all of the information that I've provided today. And I would encourage you to look further into those because they're, especially the Services Australia e-learning has been updated in the last year and is certainly very useful to help get your head around all the different facets of obviously Medicare, but also specific to this around team care of our patients. So Jenny, do we have any questions?
We haven't got any questions that have come through as of yet.
Okay.
I'm just going to unmute everybody. So I have unmuted everybody. If anyone would like to ask a question, now's your time. Thank you very much, Sarah, for presenting today.
No problem.
I think you've given us such a comprehensive presentation that we don't have any questions, which is fantastic. If you would like to contact Sarah, please send me, the education team, an email. You'll all have our email address and we can pass her contact details on to you all. Thanks everybody, and have a good rest of the week. Bye-bye.
Thank you. Bye.